just to share some more stats with you, up to 33% of patients with MCI or mild cognitive impairment can go on to develop Alzheimer's or dementia without intervention. And up to 40% of Alzheimer's disease and related dementias may be preventable or delayed by addressing the key risk factors, which I've touched on earlier. For example, hearing intervention, social isolation, diet and exercise, and other, modifiable risks.
Yeah. I mean, while it's not causal, honestly, if I had some kind of early cognition issue, I'd probably get a hearing aid first and foremost, right? Almost as preventative, right? But anyway, it's fascinating, the 45% stat that you gave about it slowing that progression. I mean, that's really fascinating. Dr. Hamway, what about you? What's happening? New innovations in primary care or things that you're thinking about for the future?
Well, I think the future is now in primary care. So many more screening and diagnostic and treatment for certain cases that we used to refer out. We are now treating as a primary care physician because it is so difficult to get to a specialist. It's such a long road to get to a specialist. It takes sometimes in this county 3 to 6 months to get to a neurologist, for instance. So we are doing more than ever now in treating diabetes, for instance, and cognitive impairment. We're doing a lot more than we used to do, just initially because we don't have the specialists in a timely manner to refer out to. So the future is now, and we are looking at different things that we can bring into the office. The hearing evaluation was amazing. That's such a great asset and such a great advantage to patients, so that it's a good benefit for them. And we're trying to look at other things also to bring in to just help give overall care to the patients.
I love the fact that, we're bringing it back to the primary care office, which is much more efficient for patients, for sure. What would you say to somebody who's considering this hearing and cognition services? What would you say to other colleagues thinking about it?
I think it's an amazing benefit for both the office, for the practice, and for the patients. We don't have to refer out. People ask all the time, well, who do you trust to do hearing tests? People are very skeptical. Everybody wants to sell them a hearing aid. So trust is very important. And it just facilitated it. We don't have to go through that referral process. We make the appointment for them right there and then. And it's convenient. And we know now that we're able to get the patient to get that hearing test because they trust that we trust that they're going to do it. It's in the office and they go through with it. So I would absolutely recommend it to anyone.
Yeah. And you can see what's happening, right? So, and I'm sure you could watch a hearing test if you wanted to, right, Daniel?
That's right.